thank you all for standing by and welcome to our webinar entitled Climate Change and Public Health. These webinars are an initiative of the Ohio State University Climate Change Outreach Team, a multi-departmental effort within the university led by OSU Extension, Ohio Sea Grant, Bird Polar Research Center, and 6 other OSU departments to help localize the climate change issue for Ohioans and Great Lakes residents. I am Jill Gentis-Banicki from Ohio Sea Grant and Stone Laboratory, and joining me today is Dr. George Luber. Dr. Luber is an epidemiologist and the Associate Director for Climate Change at the Centers for Disease Control and Prevention. In addition to managing the Climate Change Program at the CDC, Dr. Luber is a co-chair of the Climate Change and Human Health Interagency Work Group at the U.S. Global Change Research Program, a convening lead author and member of the Federal Advisory Committee for the U.S. National Climate Assessment, a member of the American Anthropological Association's Presidential Task Force on Climate Change, and the lead author for the Intergovernmental Panel on Climate Change, 5th Assessment Report. We're delighted to have Dr. Luber here today to discuss how climate change could affect public health. But before we do that, a few logistical issues as we get started. During our presentation, all participants will be in a listen-only mode. Afterwards, around 12:40 or so, I will conduct a question and answer session. If you would like to ask a question during the presentation, please feel free to use the chat feature located on the right-hand side of your screen, and I will collect and pose your questions out to Dr. Luber at the end of his presentation. We have nearly 200 participants so far on this webinar, a great diverse group representing governmental agencies, academia, and nonprofit groups from the Great Lakes and around the country. Please keep those questions coming throughout the presentation, and we should have a great Q&A session. As a reminder, this webinar is being recorded and will be posted on our website for later viewing. Also, we will post a webinar survey in the chat feature toward the end of the hour. Please take a few minutes after the webinar to fill out that survey. It will help us continue to bring you better webinars. So without further delay, I'd like to introduce Dr. George Luber from the CDC, who will present climate change and public health. And George, I am going to unmute you right now. You should be able to talk.
Good afternoon, everyone. It's a pleasure to be here today, and so great to see such a tremendous amount of interest in this topic. Before I begin, I would like to personally thank Jill Gentis-Banicki for inviting me to speak today. This webinar series has a distinguished list of previous speakers, and I feel honored to be part of those. Previous speakers on health have included Dr. Lonnie King and Dr. Jonathan Patz, who are both pioneers and really mavericks in their field. So it's a great honor for me to join the likes of them. And I actually have looked through the archive of the previous webinars, and what an excellent resource this is for those in the Great Lakes. And I hope to do those presentations justice with mine. I'd like today to first figure out how to work this. There it is. I'd like today to review in a summary fashion the evidence for the health consequences of a changing climate, and at the same time bring in a new resource that has become available for those interested in climate change impacts in the United States, and that is the 3rd U.S. National Climate Assessment, which has been released for a couple of weeks in a public comment draft. I've spent the last year and a half working with a team of co-authors in developing the health chapter for this, and I'd like to introduce you to the National Climate Assessment, its process, products, and the draft findings that are relevant not only for the U.S. but in particular for the residents of the Great Lakes. And I guess one of my overarching goals is to provide some warmth through the images of global climate change to those of you suffering through a tremendous winter storm that as I looked at the weather forecast this morning, was hitting many parts of the Midwest. I hope the power stays on long enough. Jill mentioned that I'm part of the current 5th assessment report for the Intergovernmental Panel on Climate Change, and I bring this image of the 3 working group reports of the 4th IPCC report, the 4th assessment report, published in 2007. If you recall, this is the report that, along with Al Gore, the authors won the Nobel Prize. And I bring this up because this really was a turning point in the health sector engagement with climate change. Certainly folks such as Jonathan Patz, Paul Epstein, Michael McGeehan, and others, Howie Frumkin among them, have been working on climate change and raising its importance within the public health arena. But the publication of this report really provided sufficient evidence to act within the public health sector, and the amount of work since then has been tremendous. And I believe this signals a change in the types of questions that are being asked in the climate change community. Prior to the release of the fourth assessment report in 2007, the primary questions were, A, is global warming occurring? B, are human activities responsible? And can we quantify the relative contribution of various climate-forcing factors, such as anthropogenic emissions, land use change, etc., in gaining a full understanding of the various roles of climate drivers in climate change? The fourth assessment report unequivocally put these questions to rest, and we now are in an era of facing a qualitatively different set of questions. And this is where engagement with sectors such as health really comes into play. So the post-fourth assessment report questions that predominate in the field are, what is the rate and magnitude of change? We understand this is not linear, that there are multiple thresholds and tipping points, and the rate of change really is important when we discuss adaptation. Second, how can we mitigate greenhouse gas emissions? What are our options for stemming the runaway rate of climate change that is being forecasted? And certainly, but not least, given that we have a climate commitment, meaning we are already committed to a certain amount of warming as a result of historic releases of greenhouse gases, what are the ways in which human and natural systems can adapt to these changes? We have to develop the science of adaptation to understand our possible avenues for coping with the various changes that are inevitable within the Earth's atmosphere and natural systems. So, to summarize quickly, climate change is happening now. The IPCC Fourth Assessment Report states that warming is unequivocal, that biological and physical systems on all continents are already affected by climate change. This isn't a polar phenomenon. This is a phenomenon that affects the northern latitudes as well as the tropics. And most importantly, as I alluded to in the previous slide, that we are already committed to more warming over the next few decades. Choices about emissions now will really affect the longer-term climate change signal that we have to deal with. And certainly the indicators of a warming world are all around us. These are 10 of the key indicators that we have sufficient evidence to show that these changes are occurring in our oceans, in terrestrial ecosystems, and in the cryosphere currently. And just to highlight one local effect of climate change, this was an image that I pinched from the draft National Climate Assessment Report, showing the decline in ice coverage over the Great Lakes. There's some startling images right there between March 2003 and March 2012, mirrored with a gradual decline, a decadal decline in ice coverage over the Great Lakes. So what are the future projections that we are as a public health organization likely to deal with? Well, first of all, heat waves will become more intense and more frequent. Very likely that heavy rainfall, this is rainfall above the 99th percentile for an area, will become more frequent. And we're going to tie in what some of those health consequences are shortly. Tropical cyclones, large storms, will perhaps not become more numerous. I think the evidence is still out on that, but certainly more intense with larger peak wind speeds and more heavy rainfall. And since I'm from Florida, I can tell you that we don't really care about the Category 1 or 2 hurricanes. It's really the 4 and the 5 hurricanes that keep us up at night. And certainly areas that are dry will become drier, areas that are wet will become wetter, and an associated storm-related sea level rise coincident with a thermal expansion of the oceans is going to become a problem. And this was highlighted most vividly last fall in the Northeast with Superstorm Sandy. One thing we have to understand, and is critical in our engagement with this science, is that warming is uneven. That various, because of changes in land use, for example, in the Southeast, or changes in precipitation, that warming will vary significantly by region, and the approach to understanding climate impacts must be local. This is an image showing the rate of change over the last 110 years over the United States, and you can see that certainly some areas have warmed up more than others. Not only will we experience an increase in the mean and average temperatures over a region, what we call, well, I guess climate, not what weather is what we, I'm sorry, climate is what you expect and weather is what you get. It's been explained to me. But certainly from a public health standpoint, the extreme weather will become more challenging. And this is a quote that I was recently exposed to by Michael Mann, a climatologist. And he says, if you take the basketball court and raise it a foot, you're going to see more slam dunks. But not every dunk is due to raising the floor. But you'll start seeing them happen more often than they ought to. And this is a great analogy to think about the change in probabilities of extreme weather that accompany changes, small changes in the mean for a region. And some of these extreme events are going to be far outside our realm of experience. And this was exemplified, I guess, best with the European heat wave of 2003, which was such an anomalous event of magnitude and duration that it caught the public health, particularly public health agencies and officials in Western Europe, completely off guard. Confirmed mortality associated with this single heat wave, this is mortality that is recorded on the death certificate, totaled around 30,000. If you look at excess mortality, that is the mortality observed over the mortality expected, those numbers are close to 70,000 in subsequent published reports, clearly indicating that our ability to cope with these very anomalous events is limited and must be enhanced. But along with changes in climate that I've briefly outlined, we have to understand the coevolution of other built environment trends that also place more populations at risk. And certainly cities and climate are co-evolving in a manner that will place more populations at risk. To begin with, we will have, over the coming century, an increase in those populations vulnerable to the impacts of extreme weather and climate change. We have more people living in urban areas and more elderly people as well. And I'm going to detail some of that in a second. But what this describes is an intensification of exposures as a result of the urban form, as well as the co-occurrence of vulnerable populations within that location. So first, onto the population piece of this vulnerability puzzle, we see projections of the U.S. population pyramid from 2000 to 2050 show an almost elimination of the concept of a population pyramid. We see a much larger proportion of our population over age 60, up until the year 2050. And if we look at global population, this is just not a U.S. phenomenon. Global population over 60 years old is projected to increase to a proportion of 22% of the world's population, looking from in 2050. Certainly, the global population is aging. And I mentioned that the other demographic transformation that occurs with this aging is the shift, historic shift, from a largely rural population previous to 2008 or 9, whenever you choose that point, to the human species being a largely urban population currently and into the future. And these urban environments have particular exposures that work hand in hand with climate change that are going to be of concern to public health officials. And the first is the urban heat island. Many of you have heard of the urban heat island effect. The urban heat island describes the thermal capacity of cities to absorb solar radiation that's incipient upon it during the day, store it with the high thermal mass of the engineered materials that have high density in urban areas, along with the low proportion of tree canopy and ground cover, and elevate the nighttime temperature versus the surrounding rural areas. And the urban heat island in many locations can add from 7 to 12 degrees of temperature versus the surrounding rural areas. This is a nighttime satellite thermal image of Phoenix, Arizona, and it's worth noting that while Phoenix sits in a very dry climate, the Chihuahuan Desert. The Sonoran Desert. It typically cools down significantly during the night. The diurnal temperature range, or the difference between the daytime high and the nighttime low, is much greater than it is in more tropical, moist climates such as Georgia or Florida. Well, Phoenix, as a result of the urban heat island, recorded a record nighttime low of 99 degrees in 2009, indicating that the trend towards nighttime warming is going to pose significant challenges for urban air conditioning, cooling, peak energy demand, and enhances or lengthens the exposure to extreme heat that would normally subside during the night. Not only does the urban heat island impact exposure to extreme temperatures, which have associations with morbidity and mortality, but it also has impacts on air quality. This is a graph showing the association between temperature and maximum daily ground level or tropospheric ozone concentrations. And there's a lovely image of sunny Atlanta with our air quality problems as well. And certainly an increase in temperature over time works synergistically with pre-existing smog precursors through a photochemical reaction to produce ground level ozone that will increase in its importance to public health departments, indicated by increases in emergency room visits and hospitalizations for respiratory illnesses in the future. Not only are we going to deal with degraded air quality as a result of ozone, but we also have other interactions that degrade air quality and account for significant impacts on healthcare costs and morbidity and mortality in particular areas, including cities. This is a slide describing the impact of the elevated carbon dioxide in urban areas, a phenomenon known as the CO2 dome, and its impact on urban aeroallergens. This study, conducted by Louis Siska at USDA, compared ragweed plants that were located in rural, suburban, and urban areas around Baltimore to show the effect, or to measure the effect, of elevated CO2. In this case, the plant located in the urban part of Baltimore was exposed to around 500 parts per million of CO2, while the rural plant was exposed to global background levels of high 390, of 400 parts per million. And you can see the production of pollen by this urban located plant was significantly altered by its location within the urban CO2 dome, producing about 12,000 pollen grains per cubic meter of air versus its rural counterpart, about 2,200. And we're seeing impacts. Subsequent studies conducted by Louis Siska and other colleagues, such as Kim Knowlton, have highlighted the impact of longer growing seasons, shortened early arrival of spring on not only the length of pollen season, but also the overall production of these pollen-generating plants over the course of a year, stimulated by increased temperatures as well as CO2. Ragweed is not the only plant that is impacted by elevated CO2. Poison ivy, for example, is also stimulated by this carbon fertilization effect, leading to not only increased growth in biomass, but also increased production of its allergenic compound, urushiol. So we have super poison ivy to deal with in the future as well. One of the critical components of a warming climate is its impact on the hydrologic cycle. And certainly physics tells us that as the atmosphere increases in temperature, its ability to hold moisture increases as well, greater amount of water vapor in the air. And this increase in water vapor leads to increases in very heavy precipitation. This is another image straight out of the National Climate Assessment Draft Report, and it shows changes in heavy rainfall are going to affect many parts of the United States, including the Midwest, this is observed, that these trends in heavy precipitation have been occurring in many parts of the United States and the U.S. as a whole. Why do we care about this? Well, extreme precipitation is associated with waterborne disease outbreaks in the United States. This study, conducted by Frank Curiera and Jonathan Patz, showed that about 2/3 of waterborne disease outbreaks were preceded by rainfall above the 80th percentile, and fully half of outbreaks were preceded by rainfall above the 90th percentile. The classic example of waterborne disease outbreaks and heavy rainfall is certainly this well described one within the Great Lakes area of cryptosporidium outbreak of 400,000 cases and 54 deaths. Certainly not a trivial event, and not just in the numbers of cases, hospitalizations, and deaths, but medical costs and productivity as well. And this event within Milwaukee, this cryptosporidium outbreak, as well, was preceded by the heaviest rainfall in 50 years. There are other effects of changes in the hydrologic cycle that we'll have to deal with in the western United States, and this was clearly evident in the fire season and the drought effects of last season, and unfortunately predicted to increase this year. We have witnessed a change in wildfire season as snowpack and precipitation and temperatures have increased in the Intermountain and West. The drier climates lead to increased forest fires and smoke. Not only has the wildfire season increased in duration, but the average duration of these fires has increased fivefold as well. Why is this important? Well, if we get an increase of PM10 from wildfires, an increase of 10 micrograms per cubic meter of PM10, we see, in many studies have shown, an increase in mortality of approximately 1%. And studies looking at the brush fires a couple of years ago in Australia showed that during the Australian brush fires, that overall mortality rose 5%, and admissions, hospital admissions for respiratory illness, increased from 3 to 5%. Another impact of a changing climate on ecosystems that is significant for health. I mentioned tropical cyclones, and as sea surface temperatures rise, tropical cyclone intensity and the subsequent height of storm surges accompanying these intense storms are increasing as well. Certainly our window of observation for tropical cyclones is not very deep, beginning really at the advent of the satellite era, but there are trends in the incidence of extreme or Category 4 and 5 hurricanes, as we see in this chart, indicating that if not more storms that we ought to be worried about from a public health perspective. Other changes in the hydrologic cycle include the increased incidence of harmful algal blooms. This is enhanced not only by increased water temperatures, but nutrient runoff following heavy rainfall and upwelling events from thermal stratification of water bodies. The image in the lower left was I'm just forgetting what the bloom was. A microcystin bloom on Lake Erie in 2011. The image on the lower left, which is a significant concern for recreational water use. The image on the upper right is a marine harmful algal bloom, the classic Florida red tide. This one is Carina brevis, which too has some deleterious health effects through the aerosolization of its toxin, brevetoxin, that affect coastal residents and those recreating on the beach. Other impacts of harmful algal blooms are a little more subtle. The ciguatera fish poisoning is a formerly tropical marine toxin produced by a dinoflagellate living symbiotically with algae in an algal matrix. And as sea surface temperatures have warmed, the geographic range of this harmful algal bloom, ciguatera fish poisoning, which incidentally is the world's most common form of seafood intoxication with over 50,000 cases per year. We've recently identified cases of ciguatera in individuals who consumed locally caught fish off the northern Gulf of Mexico and even as far north as South Carolina on the Atlantic coast, indicating a shift in the geographic range of this formerly tropical marine toxin. Much of the attention in the press and in the public media has to do with the spread of infectious diseases with climate change. And startling titles like this are not uncommon. And in fact, the IPCC predicts that because of climate change, vector distributions will increase in latitude poleward and altitude up mountains as disease ecologies shift. In the United States, we're intimately familiar with Lyme disease. Lyme disease is perhaps the most common vector-borne disease, or actually the reportable vector-borne disease. And many studies, there are several studies, this one from Brownstein et al., show a change in the range of suitable conditions for Ixodes scapularis, the Lyme disease vector, from today into 2080. And this is the result of complex interactions between changing ecological conditions, some as a result of changing land use practices, forestry practices, for example, but also changes brought on by climate change, along with social factors that modulate exposure, such as recreational activities, gardening or hiking, and as well as climate factors that enhance all of those. And as we see, as I animate this map, that the suitable range for Ixodes is expanding westward and northward into 2080. And if we look at observed changes in Lyme disease and its incidence in the United States, you can see some confirmation of those projections in this U.S. case distribution over a 16-year trend in the United States, certainly a northward expansion of Lyme disease into New England, soon to be our newest export to Canada. In addition to experiencing some changes in geography, we can expect some surprises, and this is one of them. The appearance of a rare genotype of a fungal illness, a fungal organism called Cryptococcus gattii, caused an outbreak on Vancouver Island in British Columbia, presumably brought to Vancouver from a subtropical climate, tropical or subtropical climate, as this organism is most suited to those climates. In ship ballast, it found a foothold on Vancouver Island and has subsequently spread into Washington and Oregon, and cases in Northern California are occurring as well. Now, we must caution that there are numbers of factors in disease emergence. Some of them are genetic and microbiological or biological factors, adaptation to certain climates, and there are other environmental drivers to disease spread and disease emergence, such as climate and weather, but also economic development. I mentioned in the Ciguatera slide that sea surface temperature was at play, but it's important to also note that the construction since the 60s of about 4,000 oil rig platforms has also provided a suitable substrate, a hard substrate, since the Gulf of Mexico is muddy bottom, that allow coral ecosystems to develop, so they work synergistically. But ecological factors such as changing human ecosystems and human demographics and behavior have factors to play as well. My take-home point for this disease emergence is that it's, yes, multifactorial. Climate and weather are one of the factors that are important to consider in disease emergence. As we look long-term on climate change effects on health, a more difficult picture emerges. And early on in the discussion of climate change impacts on agriculture, there was a bit of a rosy picture to paint. Much of the early evidence showed that, well, with the longer growing season, reduction in frost-free days, or an increase in frost-free days, along with the carbon fertilization effect, that we will have an increase in our agricultural productivity, especially in countries that practice industrialized or irrigated agriculture, and especially in the northern latitudes where the warming signal is the greatest. In fact, early studies by Cynthia Rosenzweig and Martin Perry showed that adaptation with direct CO2 effects favored developed countries that had more control over irrigation and water management. These are three different climate models. Apologies for the rather antiquated image. It is an old paper. But important to point out on here is that these percent yield changes of cereal yields had an assumption of a positive direct effect on CO2 on yields, certainly favoring, again, developed countries and not favoring developing countries that in many cases rely on rain-fed agriculture, so no control over the hydrologic inputs into agriculture. Well, emerging evidence is showing that rosy picture of CO2 fertilization might not be all that true. This is a study that's in a meta-analysis of the effect of elevated carbon dioxide on the protein concentration of food crops. So instead of looking at the impact on biomass, researchers are increasingly looking to the nutritional quality of key food crops and the impact of CO2 fertilization on these plants. And this is a study that's showing that across 5 major cereal grains, what essentially feeds the world, that all 5 of them show a negative effect of protein concentration under conditions of elevated CO2, indicating that while we might have an increase in biomass production, that we will be feeding a growing population, perhaps a world of 9 billion people, with cereal grains that are much less nutritious. And this impact is not just seen on protein concentrations of these crops, but also micronutrient levels as well, painting a very scary picture for agriculture in the future. Scary pictures aside, it's important to understand that the consequence of changing ecosystems, extreme weather events, is not limited to the direct effects of storms on injuries and on mortality, but there are much longer and significant impacts for individuals and public health systems as a result of the increase in frequency of disasters. This certainly came to light in looking at Hurricane Katrina, and is brought home very, very recently with Superstorm Sandy, that the most persistent effect of these storms on individuals and communities are the mental health problems. And our capacity to deal with post-disaster mental health issues needs to be enhanced. But the picture doesn't end there. There's also a toll on the anticipatory mental health impacts of climate change. Living in a world where we have frightening stories like the one I'm telling has an impact upon people. The climate change scenarios scare and hopefully in this case says motivate kids. My favorite story is the one on the right, where it says that climate change is kids' top fear. And having children, I know how important this is. But this survey showed that 3/4 of 11 to 14-year-olds worry about climate change, compared to only 41% who are worried about going out with somebody. Now that's some pretty stiff competition. And if climate change is ranking high up on the list of kids' top fears, we need to seize upon that opportunity to provide a positive message. I know Matthew Nisbet spoke in this series prior to this, and he has some very eloquent words to say on how we construct messages to engage climate change in a manner that promotes action and not paralysis, and it's something very important to keep in mind. So this is a very complicated and busy slide, but it basically summarizes from direct to tertiary impacts the potential health effects of climate change. And I mentioned we've discussed the direct effects of extreme weather and heat and air pollution on health, but also the impact of changing ecosystems on allergic rhinitis, allergic airway disease, vector-borne diseases, and waterborne diseases. And certainly as we look at the downstream of the impacts of degraded ecosystems, we have to understand the impact of degraded water and food quality, mental health, and conflict as a result of access to scarce resources, and the consequence of that for environmental refugees. So certainly the take-home message is that climate change will have a broad impact on many health outcomes that we currently experience, including bringing some new challenges to the front as well. I'd like to switch gears right now and switch background templates as well for my PowerPoint slide to introduce to you the draft findings of the U.S. National Climate Assessment. And I bring this to you now because we're in a very critical phase with the National Climate Assessment that I would like to make the plea for you as listeners to engage with this process in this critical moment. I'm using the National Climate Assessment backgrounds because this represents not just the work of CDC, but the work of all these agencies and individuals that are working in a volunteer capacity for the National Climate Assessment and want to, from here on out, represent not the views of myself and my agency, but of the National Climate Assessment as a whole. Now, the National Climate Assessment is a report that is mandated by the Global Change Research Act of 1990, and this act requires that the U.S. conduct a national climate assessment not less frequently than every 4 years. And this report shall provide an assessment that integrates, evaluates, and interprets finding of the U.S. Global Change Research Program, which is the coordinating body of federal climate change research. If you haven't visited the USGCRP webpage, usgcrp.gov, please do so. There's a wide variety of materials that would be of use. So you noted that you might notice that we're about to release our third National Climate Assessment, being 23 years after the signing of this Global Change Research Act of 1990, which is pretty good for government work. That we're about to release the third, and in that act, it requires that the effects of global change be analyzed not just on the natural environment, but also on multiple sectors that will be impacted as well. And in the law, human health is one of those sectors that's called out. And it requires us to not just analyze current trends in global change, but also project these major trends for the subsequent 25 to 100 years. Here are the images of the previous National Climate Assessment, one in 2000, another one in 2009, and we will be releasing, after the review process, our report in 2014. Now, this is a report that builds upon, again, an emerging interest in the public health sector on climate change. These are recent assessments that focus on health that have been produced not just by the U.S. Global Change Research Program, but also by the UK, Health Canada, and Australia as well, also providing very contextualized, regionalized evidence for these impacts on climate change. The Health Protection Agency of the UK just released their report, The Health Effects of Climate Change in the UK, in 2012, on their webpage. I'm about a quarter of the way through, and it's a very well done document. So a tremendous increase in interest on health related assessments. And as a note of shameless self promotion, there is an audience for these assessments. That while these assessments are done at a national scale, they're used by practitioners in a very local scale. This is a map showing the partners that our program at CDC funds and works with in developing climate change and public health adaptation plans. We currently fund 16 states and 2 cities, New York City and San Francisco, in a multi-year cooperative agreement process to work hand-in-hand with us and each other in developing a adaptation plan through an evidence-based approach that links climate science to current health impacts and health projections in a model that we call BRACE, which stands for Building Resilience Against Climate Effects. And as you'll note, there are several of these states that are located in the Midwest and the Great Lakes region that we're currently working with. So, public health representation in the NCI, I throw this up there to highlight the various individuals and institutions that are involved in the production of this report. Kim Knowlton at National Resources Defense Council and Columbia University was my co-coordinating lead author, and with the lead authors and contributing authors, we've put together this report, which I'll briefly outline in the next 4 or 5 minutes, hopefully, to give time for questions. And what's important to notice, to state about this report, is that it is first and foremost a communications document. It is a document that's aimed at bringing the state of the science to the general public and policymakers. It's not intended to be a technical document, although there's a tremendous amount of technical information in it. But it's been crafted in a way that encapsulates our findings and key messages. And these key messages are listed here. I'll go into each one in a little bit more detail. Are intended to encapsulate our findings in a way that is communicated most effectively. First key message is that, like we've discussed before, climate change threatens human health and well-being in many ways, including impacts from increased extreme weather events, such as wildfires, extreme air quality, disease transmitted by insects, food, and water, and threats to mental health. But perhaps most importantly in this statement is the statement that some of these health impacts are already underway in the United States. This is not a problem that we will be dealing with in the future, but a problem that we are dealing with now. The key message number 2 is that climate change amplifies some of the existing health threats that the nation now faces. It works synergistically with an aging population, with comorbidities and chronic disease in significant ways, and as well as other determinants of health such as poverty and lack of access to resources. Certain people and certain communities are particularly vulnerable to the impacts of climate change, and these include children, the elderly, the sick, the poor, and some communities of color. The third key message that we are promoting with this document is that public health actions, especially preparedness and prevention, can't do much to prevent people from some of the impacts of climate change. Early action on these fronts provides the largest health benefits. And as the threats increase, our ability to adapt and to expand our coping range may be limited. The key message number 4 is a feel-good message, that responding to climate change meaning reducing greenhouse gas emissions and improving air quality, provides opportunities to improve human health and well-being across many sectors. And many of these strategies offer a variety of benefits, protecting people's health, in this case, while combating climate change and providing other societal benefits. That as we work to increase air quality, we will have synergistic benefits with asthma in this case, ozone, for example, as we combat the upstream determinants or contributors to climate change. In addition to outlining several key messages, within the report, we highlight through several text boxes some real key threats that climate change will act through to affect health. And these are 3 ways of looking at the pathways by which health will be compromised. And they're set aside in the text because they tell a story in themselves, and I'll highlight these 3 briefly right here to give you a sense of the message that we'd like to bring. And the first is that climate change adds to the cumulative stresses currently faced by vulnerable populations. Not only are these individuals more vulnerable to extreme events, but their baseline health status and their persistent climate-related health threats, such as poor air quality, heat, drought, flooding, and mental health stress, will persist and be exacerbated by climate change. And over time, the accumulation of these individual stresses will be increasingly devastating to these populations. In other words, that these multiple threats and cumulative impact of climate change on vulnerable populations will be a significant challenge into the future, a sort of death by 1,000 cuts by an amplification of the exposures and health outcomes that we currently experience that are climate-related. The second is large-scale complex emergencies, that societal system failures during extreme events have the capacity to really upend public health and systems that are designed to protect health. We saw this most recently with Superstorm Sandy and the derecho windstorm, straight-line winds that affected the Mid-Atlantic last summer. And that multiple system failures during these extreme events can occur, limiting our ability to provide critical infrastructure such as egress and evacuation routes and response services during these extreme events. The loss of EMS, 911, and power during the derechos in the Mid-Atlantic was particularly concerning. That our ability to, during a heat wave, that individuals lost their primary adaptation to extreme heat, and that is air conditioning. And the point is that these extreme events, through their increase in magnitude and duration, can exceed the response capacity and deplete our reserves from an individual to a national scale, especially in the case of repeat events. The third message is that through large-scale environmental change, we tip the odds in favor of novel disease emergence. So climate change is causing large-scale environmental change, which increases the likelihood of emergence or reemergence of unfamiliar disease threats. These include shifting pest ranges, lack of immunity and preparedness, and inadequate monitoring of shifts in environmental conditions. So particular findings from the Midwest chapter, I failed to mention, but the National Climate Assessment is organized by sectors, health being one of them, and regions as well, in addition to some basic climate science chapters. And there is a Midwest chapter. And the Midwest chapter shows that average annual temperature increases by the end of the century in the Midwest could exceed 6 to 8 degrees. Crop yields are expected to decline with increased average summer high temperatures, and challenges of extreme heavy precipitation will face the Midwest as well. In the health context of the Midwest chapter, one study predicts that additional 166 to 2,177 deaths in Chicago from extreme heat towards the end of the century. Going along with that, worsened air pollution is likely to be experienced, as well as an increase, as we've already talked about, in pollen season length and levels. But benefits, citing recent studies by Jonathan Patz and his colleagues, show the benefits of reducing heat-trapping gases. Using his triple win study in Madison, showing that using bicycles for all trips less than 5 miles could save a substantial amount of lives, about 1,300 lives and $8 billion in 11 metro areas in the Midwest, highlighting the potential co-benefits of tackling climate mitigation or climate change. So, to conclude, there are opportunities for your participation. There have been a number of regional town hall meetings hosted by the U.S. Global Change Research Program, and the link that you see on the page will give you a listing of those regional town hall meetings. I was just at one last week in the Southeast presenting on the findings with some excellent feedback. We are currently in the open public comment period that extends until April the 12th, and that open period allows individuals and organizations as well to provide comments on the draft report, which is now available at that link. And those comments will be very critical for us to address deficiencies or gaps or errors within our report. Thirdly, there is a standing network of organizations called the National Climate Assessment Net, NACANet, which has been created to encourage collaboration or integration of non-governmental organizations, universities, etc., to work with the National Climate Assessment, to engage producers and users of this assessment information and make the assessment better. The idea is that we're going to extend this one-off or once every 10-year assessment process into a sustained assessment that will be continuously updated through the NACANet and other vehicles, including these products that will be created along with the final report and to endure long after the final report. And the first among those is a set of indicators. For our sector, it would be climate health and vulnerability indicators that can be monitored and utilized and updated by the health sector for an ongoing or sustained assessment through time. In addition to the creation of new measures, all of the inputs, technical inputs that were created by individuals or organizations for a consideration in the NCA report will be posted publicly, amounting to a significant resource that individuals can use in their research. This, for the health sector, will include a comprehensive literature review, regional scans that we conducted, and workshop summaries to summarize the state of the work in climate and health. And the intent is to put all the inputs provided for the National Climate Assessment on the NCA website, but first, information quality guidelines must first be finalized. So with that, I'd like to, again, thank you for your time, thank Ohio State for the opportunity to speak with you, and hopefully we have time for some questions.
Thanks, Dr. Luber. We have gotten some great questions during the presentation, so I guess let me just get started and ask you as many as we can, and what questions that Dr. Luber can't answer today, we'll post later on the website with his answers. Okay, we've gotten quite a few questions dealing specifically with different things that could affect climate change, so let me just kind of go through a few of those. One question we had was dealing with ticks. They were asking that they were seeing a big expansion of ticks in Ontario. Is there someone looking at the effects of climate change on ticks, hosts, and habitats?
In Canada?
I would assume in Canada, but maybe in general too.
There's an emerging and rather robust collaboration between the CDC and the Public Health Agency of Canada and Health Canada, the two lead organizations for that. An individual named Nick Ogden, O-G-D-E-N, is the lead person from the Public Health Agency of Canada on Lyme disease, and his group is conducting some current assessments of tick and abundance studies, I believe. I recently heard a presentation by him on that. I would suggest contacting Nick Ogden or Public Health Agency of Canada for those impacts in Ontario.
Okay, thank you. Another question dealing with algal blooms and liver cancer. One was asking whether or not there have been some links between those two in the U.S.
Many of the cyanobacterial blooms, Cylindrospermopsis, for example, produces hepatotoxins. Linking those with incidents of liver cancers is a difficult task because the appearance of these blooms in fresh waters and in reservoirs, for example, does not indicate or necessarily mean consumption, especially through drinking water treatment systems. It's certainly true that cell death or lysis exposes drinking water to these toxins, but I'm not aware of any studies that have showed a systematically an impact of hepatotoxins produced by cyanobacterial blooms on liver cancer. Their presence is of concern and needs to be monitored, but the purported health effects of harmful algal blooms is, aside from the recreational exposures or the exposures through food products such as paralytic shellfish poisoning, domoic acid, and ciguatera fish poisoning, is still an emerging field and one that desperately needs research to work on it.
Okay, thank you. Another question we had was, have there been conclusive epidemiological studies done on topics other than heat waves exhibiting relationships between climate change and disease? For instance, air pollution. And which do you recommend that they read?
I think I provided, what I attempted to provide at the beginning part of this talk was an overview of the various health effects that have been linked epidemiologically to events that are climate related. So, for example, wildfires and degraded air quality. There is an association between wildfire activity and health outcomes, both direct from injuries and motor vehicle accidents through reduced visibility, but indirectly through impacts of wildfires on air pollution and hospitalization rates. Now, the question is linking wildfire activity to climate change, so it's a stepwise approach. No particular wildfire is associated with climate change, but the frequency of them can be. So there's robust evidence with air quality and trends in air quality associated with increased temperatures or changes in hydrology, such as drought and dust storms, and some infectious diseases such as coccidioides or valley fever, showing increased rates as a result of increased time in drought. The second is through ozone. There's been a number of studies showing increased temperature. I showed some images, but Kim Knowlton and colleagues have done some fantastic studies showing the impact of rising temperatures on degraded air quality, and so on and so forth. I think the health effects and the studies that I listed are some of the exemplars in that approach. Now, there is a report that an interagency report that CDC, along with others, co-authored, called a Human Health Perspective on Climate Change. There's an image of that report and in one of the early slides that it attempted to outline not just the state of our knowledge on the health effects of climate change, but also what we don't know. More importantly, what we don't know, because there is a lot we don't know, or still have to firm up the association from A to B to C. I would encourage those interested to take a look at that report and as resources for outstanding literature on particular health effects.
Thank you. A few more questions. One question I had from several people was, currently healthcare is costing the U.S. a stunning $2.8 trillion a year. Is there a monetary estimate for the impact of climate change on public health?
Well, there are a number of attempts to do that from particular weather events. Some of my colleagues in my program here at CDC are working on those estimates. But there was a fantastic report produced by Natural Resources Defense Council. I mentioned Kim Knowlton and colleagues looking at billion-dollar weather disasters and quantifying some of the healthcare associated costs of the additional costs that the climate change will bring. That report is available. It was released. It was done by those folks, but it was actually published in a journal called Health Affairs, I believe, about a year ago. And Kim Knowlton is the principal author. You can tell I'm a big fan. Hi, Kim, if you're on. But the excellent article that I think is probably exemplifies the best of the work being done on that topic to date, and it shows a substantial current and future impact on healthcare costs associated with climate change. And if we just look at the direct effects of increased deaths due to heat exposure, cardiovascular and respiratory deaths, to degraded air quality, that the numbers start adding up rather quickly.
Okay, thank you. We've had quite a few questions dealing kind of with the overall theme of what can I do to mitigate. And so I wanted to give you an opportunity to kind of talk a little bit about, given the scope of the consequences of climate change, what advice can you give? And we've gotten people, give politicians, given current budget constraints, what steps they can take to mitigate the consequences. We've also gotten people who have asked, like, from a federal employee perspective, federal agency perspective. So can you talk a little bit about that?
I would say that, and building upon the advice that's been delivered by folks such as Matt Nisbet and Ed Maybach in their discussion about what motivates people to act on climate change, I would offer that the greatest contribution that we in this audience can have to climate action is to highlight not only the economic benefits of climate action for reduced dependency on fossil fuels, energy costs, etc., but to attach those to some substantial societal benefits, improved quality of life, and improved health. At the same time, highlighting the economic benefits that those actions will have. So instead of doing climate change for the environment, to switch it on as, in order to promote climate action for polar bears, plants, and penguins, we should be promoting climate action for people's sake. And that frame has been demonstrated by folks such as Matt Nisbet to be a more powerful frame for motivating action, that people's health and their pocketbooks are far more interest to them than protecting charismatic megafauna in the polar regions, for example. So I would suggest that, yes, individual and community action is extremely important, that we should walk the walk, but at the same time we have the unique capacity to demonstrate that action is beneficial on many levels, that it will improve health, that it will improve people's quality of life, and the costs associated with that. And that's a very powerful argument to make, and to encourage young researchers that might be on the line to take a look at that as a powerful motivator for climate action.
Okay, thank you. We've also had some questions dealing specifically like with resources and whether or not you would be able to shed some light on where they could possibly go for like smaller cities for health-related adaptation planning. Is it through the CDC or elsewhere, if you would know? And also how they can find out more about those cities that you had in slide 44 and gain access to that information in that report.
Oh, certainly. I would encourage folks first to take a look at our website for information about the activities that we are conducting with our partners. They're called cooperative agreements because we work cooperatively with them and are attempting to develop a cohort, or actually have developed a cohort of states that have very different threats that they're dealing with, but are all working through the same framework to arrive at solutions. Our Climate Ready States and Cities Initiative, the participants can be seen on our webpage at cdc.gov/climate and health, one word. I believe one of my staff has put up the link on the chat feature. And there's more information there about other efforts, such as the efforts by ICLEI, I-C-L-E-I. I forget the particular what the acronym stands for, and an individual named Adele Houghton on her work on local adaptation planning. I'm sure the individuals that we work with at states would be very happy to share their success stories and their actions. There are a number of pioneers in this field. New York City, for example, through their Plan YC, really did an exemplary job of outlining or bringing climate science to policy and outlining some of the challenges that they face, and I believe really helped them in their planning in response to Superstorm Sandy. That's a good place to start. I think that's a good place to start.
Okay, great. Well, thank you. Well, we are actually out of time. We have more questions, so hopefully Dr. Luber will be able to answer a few of those in a Word document that we'll later post. I did want to, again, thank you, Dr. Luber, for your willingness to talk with us today about public health and climate change. An excellent discussion, some great questions. Also, I wanted to thank NOAA, the National Sea Grant College Program, and Ohio State University for funding this webinar. I did want to mention to everyone that our survey URL for this webinar is in the chat feature, so please take a few minutes to fill that out. We would like your input as we develop a regional climate website, so please take a few minutes if you could. I also want to refer you to resources and an archive of all the previous webinar presentations, which are located on our changingclimate.osu.edu website. This webinar will be up within the next couple of days, so we will email you when that is available. This webinar series is sponsored by OSU Climate Change Outreach Team, and will continue next month. We'll send that information out later this week. Thank you again to Dr. Luber and all participants on this webinar. We hope this was beneficial and hope you'll join us again in an upcoming webinar. Thank you and have a great afternoon. Thank you, Dr. Luber.
Thank you.